guest with us. Her name is Honorable Hamida Kibwana. She's a nominated senator in the Kenya's parliament. And Senator Hamida, got a privilege to meet her on 30th June this year when we visited the Senate to make a presentation to the committee that has been investigating proliferation of religious organizations in the country. In their wisdom, they thought that this proliferation may have something to do with the mental health of both leaders and followers. And I think they are right. And so we made a presentation to this committee. And that process, we got to meet Senator Hamida and invited her for this conference. And luckily, we are privileged to have her join us today. We've been pestering her about some things already, such as the decriminalization of attempted suicide, and she'll tell us whether this is possible as she gives us her speech, as well as issues of resource allocation. We know that Senate is mainly an oversight body for counties, so probably she may want to touch on that, but she has also told me that if time allows, she'll allow some questions at the end from yourselves. So please, let's put our hands together for Senator Hamida as she comes up.
It have really been pestering me, but at the same time, I'm really happy to be here. This is where, of course, and I'm enjoying, to be here. And I even said today I want to take my time off so that I can be with you. Asanteni sana. So what I'll do is that I'll read my speech, then I think off the cuff we can discuss other issues if you'll allow me. I'm old school. Dr. Jitai was asking me whether I want technology. I said, things with PowerPoints, you can have the power, but then not the point. So I'd rather just do my stuff. Thank you. I would say all protocols observed. Ladies and gentlemen, Madaktari wote, good afternoon. I am profoundly honored to address you today at the 15th Annual Scientific Conference of the Kenya Psychiatrist Association. Our gathering underlines the vital connection between mental well-being and our mission's prosperity in the year's theme, Mental Health for Sustainable Development. Mental health is a human right as indicated by SDG's goal number 3 and Article 43 of the Constitution of Kenya. In preparation to come to this session, I got acquainted with the Kenya Mental Health Policy 2015-2030, which reveals some alarming facts. The mental disorder cases are rising exponentially in Kenya, where 20 to 25% of outpatients seeking primary health care present symptoms of mental health conditions. As I stand before you today, I wear two hats. Not only as a legislator, but as a tireless advocate for the mental well-being of every Kenyan. Mental health holds a special place in my heart, and I am committed to championing this cause, just as my esteemed colleague, the former Senator Sylvia Kasanga did. Senator Kasanga's unwavering dedication to mental health culminated in the historic passage of the Mental Health Act in June 2022, marking a significant milestone in our nation's journey towards compassion and inclusivity. Today, I pledge to build upon her legacy, advocating for legislation, awareness, and support for mental health in Kenya. I am also aware of the close relation that the association had with Senator Kasanga, and I vow to ensure all voices within the mental health space were heard and considered. These are the concrete foundations I wish to build upon. To this end, it shall be my honor to continue advocating for more funds to be allocated to mental health within Parliament. Recently, the Senate passed a resolution on my motion I had initiated to establishing separate maternity wards in every hospital for mothers who have experienced stillbirths, postpartum, and postnatal depressions. This measure seeks to provide proper care and support, recognize the unique mental and emotional challenges these mothers face. And there's one motion that went through again on mental health for police officers, because we all know what police officers go through. And I'm glad that the motion went through. While I acknowledge that such legislation pronouncements standing alone cannot address a complex web of factors affecting mental health. To confront these challenges effectively, we must target the root causes, the social determinants that often go unaddressed. Poverty, unemployment, discrimination, and limited access to education are among these determinants. In this, I pledge to walk the talk by collaborating closely with community leaders, NGOs, and experts like you to develop and implement comprehensive strategies to tackle these issues head on. Mental health awareness forms a crucial pillar to breaking the stigma associated with mental health issues. We must foster open, compassionate conversations about mental health in our homes, schools, workplaces, and communities. It is imperative that we launch nationwide campaigns dedicated to consistently raising awareness to mental health. I'm sure you all agree with me that even in Parliament, that is what we need. At least a desk for we all go through mental health issues. Ladies and gentlemen, in numerous conversations I've had with some of you, I have noted the various existing gaps, including the deficit and need for over 1,500 psychiatrists, 7,300 nurses, 5,000 allied workers, the infrastructure deficit of 19,800 beds, 32 county maternal health units, 47 community programs in the county, the need to bring mental health financing to 5% of nation budget with similar allocations in county budgets, the lack of accurate data on burden associated with mental health, and the need for the national survey. The path forward is undeniable, challenging, but together we possess the collective power to transform countless lives in Kenya. Mental health is not a remote concern. It resonates with each one of us and profoundly shapes our overall well-being. Let us labor tirelessly to ensure that every Kenyan has unhindered access to the care and support they need. As I conclude, the pursuit of mental health for sustainable development is not a mere aspiration, but it's imperative to our nation's advancement. It reflects our unwavering commitment to the well-being and prosperity of every Kenyan, but more so for our youth. By recognizing the profound influence of social determinants on mental health and implementing strategic efforts, our government can forge a path towards a healthier, more resilient, and more prosperous Kenya. Together, as mental professionals, policymakers, and advocates, let us agree to ensure that the mental well-being of our nation takes center stage in our national agenda. United, we can create a Kenya where mental health is not merely a goal, but a tangible reality for all. I want to reiterate my unwavering dedication to the cause of mental health in Kenya. I stand here not solely as a senator, but as a fellow citizen who firmly believes that we can build a society where mental health is valued, safeguarded, and promoted. With your unwavering support, we can craft a Kenya where no one suffers in silence and everyone is empowered to lead fulfilling life. I thank you all. Let us embark on this transformative journey together. Asanteni sana.